So in ninth quarter, we're in student clinic. So we are treating our classmates as well as upper and lower quarters. And then as we go into outpatient clinic, we are initially just going to be shadowing with our mentor clinicians. So typically, you'll be assigned one clinician that all of your patients will be seen under. And for the first few months, you are usually going to be a secondary. So it's just going to be a lot of absorbing and learning as we watch. And then if you have patients that you know that are, or individuals that are in the community that want to come in and be your patient, you can definitely do that as well. So I'm looking forward to kind of diving in and getting that actual experience. So far, I would say the most influential thing that has kind of occurred is having some new staff that are individuals of color. That's been extremely encouraging to see a bit more diversity coming directly in my viewpoint instead of seeing it from afar and hoping that I can have that interaction with individuals as well. And that representation, I guess you don't really think how much it matters, but it matters so much to be able to see someone that looks like you, that's successful in doing the things that you aspire to do. So having my school kind of evolve with the times and realize that they need to seek out as much representation as possible has been really encouraging as well.
I did a little bit of exploring on your Instagram, and I just want to touch on a couple of things that I saw you doing back in 2015 now, probably before you went to chiropractic school, that I think can help chiropractic students or pre-chiropractic students prepare for chiropractic school. And I'd love for you to kind of just touch on what that experience was like. So one thing you did is you did a fundraiser to raise money for yourself to go and train wherever that was for the Canadian bobsled team. And I think that that's super crucial. You talk right now about you're about to go into clinical experience and you're going to go out into the community and reach out to people and really represent yourself. And I think that's exactly what you gained experience on before you went to chiropractic school. And can you maybe just draw from previous experiences that you had where you had to put yourself out there, you had to maybe get a little uncomfortable, and you had to just have a little bit of faith that if you just showed up and you were yourself, you were authentic self, asking of others to support you, how that might help you in regards to your confidence or in regards to just maybe some of the skills you picked up along the way in regards to entering the student clinic today?
At all times, we are a brand. We are a representation of what it is that we are speaking on, that you're living kind of that truth. And when I was asking, individuals to support me, it wasn't so much that I, wasn't going to work towards, finding a normal job or anything like that. That's something I was also doing. But having that support from the community and allowing them to go on the journey with me was extremely important for me, because it allows me to be a part of something that's bigger than myself. You have 17 chiropractic clinics on the exact same street, and at the core of it, we're all offering the same thing. We want to get you moving better, not having any dysfunction, pain-free, and just living your best optimal life. But they'll come to see you, or they'll come to see me specifically based on personality, connection, and like you said, being an authentic self. The individuals that I've had the pleasure of, working with me, getting me back on the track, whether it was hot or cold track, for that matter, was that kindness and that care, and being able to be a therapist, a hairdresser, all the different hats that you have to wear when you're intimately involved with someone that is trusting you. That part of asking for help is a part of that vulnerability. And I think that every student that is looking to get into a patient-centered career needs to realize that they need to put a little piece of themselves out there so that you can connect with individuals on that personal level. And that's why they really come and see you, not just because you're going to provide an adjustment and provide some soft tissue mobilization or anything like that. It's because they really connect with you as a person and they want you to be a part of their journey as well.